Starting today, February 19th, Alberta Health Services will offer the vaccine directly to all residents in retirement centres, lodges, supportive living, and other congregate living facilities with residents who are 75 or older. And starting Wednesday, that's February 24th, any Albertan living in the community who was born in 1946 or earlier will be eligible to book an appointment for a COVID-19 vaccine. Appointment availability will be based on vaccine supply, of course. Seniors will be able to book their immunization appointment through AHS using an online and telephone booking system. A link to the online booking tool and telephone number will be posted on alberta.ca and on the Alberta Health Services website, and we will send out a reminder next week with those details. This is an exciting day for Alberta seniors, and I hope it offers a real sense of relief for the thousands of family members and friends who love and support them. So I'm also very happy to announce today that we have completed all second doses for residents in Alberta's long-term care and designated supportive living facilities. More than 29,233 residents across the province have now received 2 doses of vaccine. This represents all eligible residents at these facilities, except those too sick or otherwise unable to receive both doses. This important milestone means that thousands of Albertans can count on their loved ones being fully protected against COVID-19. These residents of long-term care and DSL centres are among the most vulnerable, of course, in our society, and we're committed to protecting them. As you know, about 2/3 of deaths from COVID-19 in Alberta have occurred in those settings, and we are very happy to see that since the vaccines began in long-term care centres, that the number of infections, of outbreaks, of hospitalizations, and of fatalities coming from long-term care has fallen dramatically. That is very good news. In addition to expanding vaccinations to all seniors aged 75 and older, I'm also pleased to announce the details for Phase 2 of Alberta's vaccine rollout. We remain focused on protecting the most vulnerable Albertans, protecting our healthcare system, and, of course, preventing outbreaks. Our vaccination rollout has always been focused on ensuring that Albertans who are most at risk of serious outcomes from COVID are protected first. So Phase 2 will roll out in 4 groups, covering 1.8 million Albertans. We expect to begin Phase 2 vaccinations in April, but this is, of course, dependent on how much supply and how many doses we get out of Ottawa. The following groups of Albertans will be eligible in Group A of Phase 2. Those will be Albertans aged 65 to 74, and First Nations and Métis people aged 50 to 64 on or off reserve or Métis settlements, as well as staff and residents of licensed supportive living who did not get vaccinated in Phase 1. And let me pause in case anybody's wondering why we have a slightly different age category for Indigenous and Métis Albertans. And the reason is that, unfortunately, that population of Indigenous Albertans has had much worse health outcomes than the broader population, much lower average age of hospitalizations, and typically more serious consequences from COVID infections. And so we are following the scientific advice to address a younger age cohort amongst Albertans from Indigenous backgrounds. Group B will include Albertans aged 18 to 64 years of age who have underlying health conditions which we know can make COVID-19 infections more deadly. Our health officials are currently working to define exactly which underlying conditions this will apply and in what priority, and that we will announce those conditions and priorities prior to Group B vaccinations starting. So Group C will cover all residents and staff of congregate living settings, including correctional facilities, homeless shelters, group homes for disabilities, mental health, and other types of licensed supportive living. Group C will also include healthcare workers and caregivers who are providing care for individuals who are at high risk of serious outcomes should they contract COVID. Finally, Group D will see all Albertans between the ages of 50 and 64 and all First Nations and Métis people between ages of 35 and 49 on and off reserve and Métis settlements will be eligible for vaccinations at that stage. I know that there are some folks who will be disappointed to hear that they must wait until Phase 3 before they're eligible for vaccination. And workers who must interact with people every day because of their jobs, like teachers, transit workers, and those hardworking Albertans who've kept our essential services like grocery stores open since day one of this pandemic, well, they might wonder why these are not in Phase 2. I understand that question, and I know that everyone wants to return to normal and be safe and be protected from the virus. But with a limited amount of vaccines, we must make difficult choices to ensure that those people who are most at risk are protected first, following the data and the scientific advice.